يا حبيبي يا حبيبي يا حبيبي。
はい、皆さん、こんにちは。今日も、やってまいりました、令和の医学座談会、司会の小倉です。今日はですね、マイシグナルというね、メイドインジャパンの検査キット、これについて、大野先生に、英語でお話しいただきます。よろしくお願いします。
Thank you, Dr. Ogura. Hello, everyone. Welcome to our video. I'm Dr. Ohno. Today's theme is My Signal, early diagnosis method of 7 types of cancer using urine exosomes. What are exosomes? Both normal cells and cancer cells release secretory granules. These secretory granules are called exosomes. Exosomes contain microRNA, mRNA. mRNA sends messages to various cells and performs a variety of functions. Exosomes from mesenchymal stem cells are used in regenerative medicine. Exosomes are also used to diagnose various diseases. MySignal is a cancer diagnostic technology that uses urinary exosomes. Urinalysis allows early diagnosis of 7 types of cancer. This is a cutting edge of exosome medicine. MySignal is a product name, high precision testing using microRNA, mRNA. 1. Collect 1 dedicated container of midstream random urine. Results are available approximately 1 month later. 2. It is indicated for colon, lung, stomach, pancreatic, esophageal, breast, and ovarian cancer. 3. Useful for monitoring the families with a frequent cancer history or hereditary cancer. 4. Potential for early detection of cancers that do not show symptoms, such as pancreatic and ovarian cancer. 5. However, internal medicine and surgery are responsible for location, stage, and definitive diagnosis. 6. In the future, it may also be applied to leukemia and malignant lymphoma. 7. Actual cost, about $700, 70,000 to 100,000 yen per test. Then, general information about cancers. If cancer is detected early and completely removed, it can be cured. The stage of cancer reflects the degree of progression, and the symptoms reflect organ damage. Highly malignant cancers that do not respond to treatment, especially in the terminal stage, are difficult to cure. Low malignant cancers that respond to treatment, especially in the early stages, are easy to cure. Ovarian, pancreatic, and other types of cancer are difficult to detect early because they do not show symptoms. All cancers are likely to cause pain and suffering in the terminal stages, but symptoms may not be noticeable in the elderly. In leukemia, cancer cells are spread throughout the body via blood vessels and lymphatic vessels from an early stage. Life expectancy prognosis is merely statistical data. 100% accuracy is impossible, and prognosis can change with medical advances. However, There's no point in focusing solely on cure when the patient is in a critical condition and on the verge of death. In this stage, palliative care is necessary. Then about my signal. 1. Cancer cells release exosomes, secretory granules for their own growth and metastasis. Exosomes contain mRNA specific to each cancer. When cancer develops, the body releases various exosomes from the brain and liver in response to each cancer. mRNA released from cancer cells, the brain, and the liver is secreted into the urine via the blood. The type of cancer can be identified mainly from mRNA derived from the brain and liver, not from mRNA derived from cancer cells. If cancer occurs, it grows. Then brain releases exosomes, liver releases exosomes. Exosomes reach kidneys, then excreted in the urine. Exosome contains mRNA. It shows the 7 types of cancers. 2. Inspection indications are colon, lung, stomach, pancreatic, esophageal, breast, and ovarian cancer. Diagnostic accuracy varies depending on the type of cancer. Sensitivity and specificity are both 70 to 90%. Definitive diagnosis requires conventional imaging diagnosis, markers, cancer screening, etc. It may have false positives and false negatives. So, it is useful for screening, but 100% definitive diagnosis is impossible. If positive, a definitive diagnosis will be made by an oncology or surgery department using imaging diagnosis or markers. If negative, it is recommended to undergo regular conventional cancer screening and repeat this test. My signal can detect 7 types of cancers: colon cancer, ovarian cancer, pancreatic cancer, stomach cancer, lung cancer, esophageal cancer, breast cancer. 3. Useful for the high-risk people who have many relatives with cancer, especially with hereditary cancer. Hereditary cancers are familial adenomatous polyposis, Peutz-Jeghers syndrome, familial breast and ovarian cancer syndrome, etc. It is recommended when there are cancer patients that are subject to my signal in the family history. High risks of cancer are Crohn's disease, ulcerative colitis, chronic pancreatitis, smoking, passive smoking, alcohol, Helicobacter pylori infection, gastric ulcers, duodenal ulcers, gastroesophageal reflux, etc. 4. Using my signal, there's a possibility of early detection of cancers that do not show symptoms, such as pancreatic and ovarian cancer. Pancreatic and ovarian cancer are asymptomatic in the early stages. Since they are discovered in the late stages, the prognosis is often poor. Early detection is expected to improve the prognosis. The degree of malignancy and the amount of cancer cells vary from patient to patient. So, at what stage the test will become positive is a future issue. And the accumulation and analysis of cases are necessary. 5. Location, stage, and definitive diagnosis are performed by internal medicine and surgery. My signal is a test to check for the presence or absence of cancer. It does not tell you which location, stage, malignancy, or surface markers are present. For location and stage diagnosis, endoscopy, imaging diagnosis, marker testing, biopsy, etc. are required. 6. In the future, it may also be applied to leukemia and malignant lymphoma. Related product is My Signal Light, product name. It examines polyamines released in the case of cancer, but it cannot identify type of cancer. Actual cost is about 17,000 yen. We will introduce a paper that provides evidence for my signal. National Library of Medicine, November 25th, 2022. Prediction of tissue of origin of early stage cancers using serum melanomes. Melanome is a kit that can simultaneously analyze the expression levels of 1,113 types of human melanomas. Based on the latest Sanger-based information by PCR. Subjects: patients with 13 types of solid cancer. Analysis: 1,990 cancer samples, 1,256 non-cancer samples. Results: approximately 100 melanomas useful for cancer diagnosis were identified. Accuracy: 0.88 for all stages, 0.90 for resectable stages, stages 0 to 2. The F1 score for distinguishing 13 types of cancer was 0.93. Other cancer diagnostic methods. 1. Genomic abnormalities. Detect genetic abnormalities in cancer cells. 2. ctDNA, circulating tumor DNA, DNA derived from cancer circulating in the blood. Higher accuracy than genomic abnormalities, 0.93, but sensitivity for early stage 1 cancer is low at 0.17. 3. X-mRNA, microRNA released as exosomes from cancer cells and normal tissues. Analyzing this secretion pattern can detect cancer with even higher accuracy. In this paper, X-mRNA was analyzed. Method and results. Exosomes are secreted from the brain and liver when a patient has cancer. 179 melanomas were detected that were effective in cancer classification. The 18 melanomas with the highest contribution to cancer type discrimination were analyzed. The majority of the 18 melanomas were derived from the patient's brain and liver, not from cancer cells. Several melanomas were abundantly expressed in CD4 plus T cells, T helper, promoting inflammation. High predictive performance was achieved for most cancer types, even in early cancer. Better performance than traditional tumor markers such as ctDNA and cancer antigens 19 to 9 and 125. The liver-brain gut neural circuit plays an important role in cancer progression and inflammation. The liver and brain may monitor the malignant status of all organs in the body. If you have any medical questions, please post them in the comments and we will do our best to answer them. Over.
どうもありがとうございました。この動画はね、今回英語で、やらせていただいておりますが、中国語版もありますので、皆さんですね、ご興味ある方はご覧ください。そして最後にチャンネル登録といいねもよろしくお願いします。
Thank you, everyone. See you.